I'm Dr. Steve Tattlebaum, and you're watching the Plastic Surgery Channel.
There are many different types of breast implants. We have a couple examples here, but there are three general categories. There's saline breast implants, there's round silicone gel implants, and the cohesive gel implants. Internationally, silicone gel implants, whether they're non-form stable or form stable implants, is really the majority of the market. And here in the United States, there is a switch over from saline, which we were exclusively using for breast augmentation 10 years ago, to a much higher percentage of patients using either a silicone gel implant or a cohesive gel implant in the clinical trials. The differences between a non-form stable silicone gel implant and a form stable silicone gel implant can be really seen just grossly in just inspecting those implants. You look at these implants here, you can see the non-form stable implant doesn't maintain the shape, particularly in the upper part of the implant, versus the cohesive gel implant, which is much more shape retaining than the non-form stable implant. The round non-form stable implants are FDA-approved products, and they're good products. They've been available for many years. These particular products, since 1992, have had a little stricter manufacturing guidelines. So this is what we would term a fourth-generation breast implant. What we've learned from the cohesive gel FDA trials is that this is what we would term a fifth-generation implant. And the unique things about this device compared to the non-form stable is that the form stability of the device is really what produces the characteristics that have been shown to enhance outcomes in breast augmentation. So you can just see that the distribution of fill in this cohesive gel device compared to this non-form stable device is much more controlled. So when you hold the implant in the hand, the gel is distributed much more evenly through that implant, and that does not change over time. So if we cut this implant in half, the gel is almost a semi-solid, and that doesn't change. If I peel the shell off this implant, the gel would sit just in the same shape as we're showing here. So controlling the distribution of fill in the implant allows the surgeon to control the distribution of fill within the breast, and that's been a very powerful tool for shaping the breast in breast augmentation. In the FDA clinical trials, what we found is that there are several main advantages to the cohesive gel devices. The first being that the rupture rates or the shell failure rates of the cohesive gel devices has been quite a bit lower than has been seen with other implant types. And that's felt to be because the shell itself has less stresses on it, as there's going to be less shell folding with this form stability of this device. We've also seen a reduced incidence of capsular contracture with these devices over time, which is probably due to, number one, the form stability of the device, which counteracts any contracting capsule as it's forming around a breast implant. It may also be due to some of the specific usage guidelines that are associated with these implants. The third is the maintenance of shape of the breast over time. So the breast shape maintains very consistently from year to year to year, which has been another big benefit. The reoperation rates with these cohesive gel devices has also been lower than other previous FDA clinical trials. And again, some of that may be due to the device and also may be due to certain practice guidelines that have been recommended for using these type devices. And then lastly, just as we discussed, the gel in this implant is more form stable. It does give patients a peace of mind that if the shell was to rupture, the gel is not going to readily escape from this implant. And so I think some patients have some apprehension about that, and so it's just a peace of mind benefit that patients have.